I'm seeing a lot of psychological disease overdose. I get reports, one doctor says this, the next one says that, the next one says that. The treatments are different. Am I looking at this wrong? Are they three different diseases that people don't pick up?
Well, unfortunately, in the field of psychology, we're not as advanced enough. We don't have the science foundation that medicine. And yet, because of it's driven by insurance, there's become this incredible emphasis on diagnosis. So every practitioner has to come up with a diagnosis. And when you see a person based on what's been the referral question, or what you've been told by someone else, and what you've been told by that person, you're just getting what I call a snapshot. And so one day a kid comes in or an adult comes in and they get diagnosed bipolar disorder. 3 weeks later, who says there's nothing wrong with them? The problem is that we become diagnosis driven. The reliability, despite what they say with the Diagnostic and Statistical Manual from the American Psychiatric Association, there really isn't a high reliability. They may do studies and come up with those results, but everyone acknowledges that in everyday life, you don't get high inter-rater reliability.
A good diagnosis usually been a good observation over at least 3 or 4 sessions, yet they want you to do it in 10 seconds.
Absolutely. That visit to the doctor, therapist, whoever, physician will not get covered by insurance unless there's a diagnosis on that form.
I always tell parents when they come to me, I have erasers on my pencils and don't expect me not to use it. And many times what you think is going to be, it doesn't work out. And as long as you're honest about how to approach your problem, solutions are found. But you have to admit, you know something, I thought this, it's not this. That's a very good physician when he can go beyond what he thought. A lot of people can't do that.
Well, you're absolutely right. And I have to tell you that every day I get calls from parents on their children where they have been to they've been to the pediatrician, they've been to the neurologist, they've been to the developmental pediatrician, they've been to the psychologist, and they have 4 different diagnoses. And of course, they're very exasperated. And then the funny thing about this is that most of the people don't do a lot of treatment. So in other words, you get evaluated, and the person writes recommendations, but no one's really spending the time with the child to get to know the child, form a real diagnosis and understanding, and then even help the child.
There's a very well-known pediatric neurologist in the southwest area of the country. I'm not going to put his name because I don't think it's fair. He's been the diagnosis PDD and OB. No one asked him what it meant for years. No one audience said, PDD and OB. Pervasive. What's NOB? Oh, not otherwise billable. And he was trying to tell him.
Yes.
Sometimes you put that diagnosis out, you're not sure. It sort of covers a lot of things until you really are sure. And he was honest about it. Sometimes you look at a kid at 15 months, they're not the same kid at 3, and some kids will look like they're going to have, say, an autistic picture. Don't. They're normal. I think it's as high as 30% inaccuracy of diagnosis on autism. They're not what they thought they were. And the only reason it's being done, so I can come to, is that it's a billable event. So maybe we should be very careful. The diagnosis /NOB, not otherwise billable, is the best way of looking at it.
Could not agree with you more. And, I think what you're referring to is autistic spectrum disorder.
Yes.
And now what I'm finding in my practice is that a huge majority of kids coming into me are being given that label. Now, the reason they're given that label is A, yes, it's a diagnostic, billable diagnosis, and B, you're safe. It covers every ground.
You can never be wrong.
You can never be wrong because there's a spectrum and there's a low end and a severe end, and really it just doesn't really mean very much.